Have you ever wondered what goes on behind the scenes during a medical checkup, especially when it involves something as complex as lupus affecting your lungs? It is natural to feel curious and a little anxious about these visits. During lung lupus checkups, doctors primarily look for signs of inflammation, damage, or changes in lung function that could be caused by systemic lupus erythematosus, commonly known as lupus. The main goal is to catch any issues early and manage them effectively. Lupus is an autoimmune disease, meaning your immune system mistakenly attacks healthy tissues, and it can affect almost any organ, including the lungs. In the lungs, this can manifest in several ways. For example, doctors look for pleurisy, which is inflammation of the lining around the lungs, causing sharp chest pain. They also watch for lupus pneumonitis, an inflammation of the lung tissue itself, which can lead to shortness of breath or a dry cough. Less commonly, lupus can cause interstitial lung disease, where the tissue deep within the lungs becomes scarred, making breathing difficult over time. Pulmonary hypertension, high blood pressure in the arteries leading to the lungs, is another serious concern they screen for, as it strains the heart and affects breathing. These conditions are carefully monitored because early detection is key to preventing further complications and preserving lung health. To assess these conditions, your doctor will perform a thorough physical exam, listening to your lungs for unusual sounds. They will likely order specific tests such as pulmonary function tests, which measure how well your lungs are working and how much air you can hold. A chest X-ray or a higher resolution computed tomography scan might be used to visualize the lung tissue and identify any inflammation or scarring. Blood tests, including C-reactive protein and erythrocyte sedimentation rate, help track inflammation levels in your body. Sometimes, more specialized tests like an echocardiogram or even a lung biopsy may be necessary if concerns are significant, but these are less common during routine checkups. An often overlooked aspect of these checkups is the 6-minute walk test, a simple but effective way to assess your functional capacity and how well your lungs support activity. It provides a real-world snapshot of your breathing efficiency. Also, your medical team pays close attention to specific antibodies, like anti-Ro or anti-La antibodies, which can sometimes be associated with a higher risk of lung involvement in lupus, guiding their vigilance during your monitoring. By understanding what your healthcare team is looking for in these lung checkups, you empower yourself to be an active participant in your care. These regular evaluations are not just about finding problems. They are about proactively managing your lupus, optimizing your breathing, and enhancing your overall quality of life, allowing you to breathe easier and live more fully with your condition.